So welcome everyone who's here. My name is Rachel Giacomantonio. I'm the Knowledge Translation Coordinator with the Maritime Spore Support Unit and your host this afternoon. If you're not familiar with the MSSU, we're one of 11 spore support units across Canada that support and conduct patient-oriented research, and we work in all three maritime provinces. Before going further, I'd like to offer a land acknowledgement that reflects my location here in Chibouctouc or Halifax, and Leah, we do have a picture of here. So I want to acknowledge that I'm in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. This territory is covered by the treaties of peace and friendship, which Mi'kmaq and Wolastoqiyik people first signed with the British Crown in 1725. I also acknowledge the histories, contributions, and legacies of the African Nova Scotian people who have been here for the last 400 years. And many of you are joining from other parts of the country or maybe in other parts of Canada. And so I'd like to invite you to reflect quietly or to add a land acknowledgement to the chat to share the lands where you live and learn. And before we dive in, a few obligatory housekeeping notes. Leah, if you want to just advance. These are probably familiar by now, so I'll go quickly. Please mute your microphone unless you're speaking. We are recording the session, so it'll be available on the MSSU YouTube channel. Closed captioning is enabled, so if you'd like to have captions, you can turn those on in your settings. And feel free to type a question in the chat at any point. And if you'd like to come on camera or ask it yourself, just include your name alongside it. And so without further ado, I'm very pleased to welcome you to our new Learning Health System in Action webinar series. And so the term learning health systems, or you might have heard the acronym LHS, can be quite confusing or it may be new for some. And so I wanted to open with a quick definition. So this one from the Agency for Healthcare Research and Quality says, in a learning health system, internal data and experience are systematically integrated with external evidence, and that knowledge is put into practice. And as a result, patients get higher quality, safer, more efficient care, and healthcare delivery organizations become better places to work. If you just, there's a couple of clicks here, Leah. So really, there's no single definition or model. What I like about this one is you can start to see that kind of focus on learning as well as on the desired outcomes. And so across a lot of these different definitions for learning health systems, there is the shared focus on generating, integrating, and applying evidence in healthcare to improve outcomes. And so as a result, the learning health systems are often visualized as learning cycles. So if you go to the next slide, you can see this is sort of our version, our graphic of this process. And it is on our website. There's a URL there, and I'll drop it in the chat later if you want to know more. But what you can see in these learning cycles is that there's different components of a learning health system that feed into each other. So you have data generated, and that's integrated with external research evidence, and it's studied to generate new knowledge and then used to improve healthcare practices, inform policy or decision-making. And then through the provision of that healthcare, new data is generated and the cycle continues. Given our patient-oriented roots, our graphic puts communities at the heart of these learning cycles, and we reflect our values and health system aims with an overarching commitment to equitable healthcare. And so it's a really flexible model, this idea of the learning cycle, and it can be applied at different levels. For example, a health authority, a network of facilities, a hospital, a unit, specific service, program, or intervention. And maybe you recognize aspects of your own work in an LHS approach, even if you call it something else. And so that's what this series is all about. We're trying to get to know this learning cycle at the heart of learning health systems. And so in each webinar, we'll zoom in on an element of the learning cycle and bring it to life with examples of how this can work in practice. And so, Leah, if you advance, this will be my last slide. I promise I will turn it over to our speakers soon. So today we're going to start on the exterior ring, looking at how external evidence generated through research or maybe by other means like evaluation can be incorporated into a learning health system. And we're lucky to have Leah Boulos and Rob Wells here to share with us an example of doing just that through a collaborative systematic review. So they're going to give a presentation on their work for about 30 minutes, and that should leave us a few minutes, maybe even 20, 25 for questions and answers. And so I will pass things over to Leah and Rob to properly introduce themselves and to get us started. Thank you.
Thanks, Rachel. And hi, everyone. So yeah, as Rachel mentioned, I'm Leah. I'm here with my co-presenter, Rob, to talk about our collaborative systematic review that we've been working on this year about digital education for cardiac surgery patients. And when we say collaborative systematic review, what we're talking about is collaborating between researchers, knowledge users, and patient partners to create a review product that is useful for all parties. And this is not a methods presentation, so there are lots of methods presentations that you may have seen over the years. This is more of a practical tips presentation to help you along if you're thinking about embarking on one of these types of reviews. I'll turn it over to Rob to introduce himself first.
Hi, everyone. My name is Rob Wells. I'm a co-lead on this project and patient partner. I'm a Newfoundlander living in Ottawa. I always describe myself that way, always a Newfoundlander. I moved here from Memorial after retiring from Memorial University after 32 years. I'll start with a photo of my home province. This photo was taken this summer in beautiful Greens Pond, Bonavista Vista Bay, Newfoundland. I'm particularly fond of that picture. My area of expertise is IT and educational technology, particularly in the development, maintenance, and support of online learning. In 2019, I underwent 2 major surgical operations within a couple of months of each other. It was tough, and it took me quite some time to recover. And this was followed by a discovery of a chronic condition that was my most significant encounter with the healthcare system to date. On a personal note, I'm a massive football fan. In fact, my wife would call it obsessive. Not American football, but British football, soccer, English Premier League, and here's my club. I won't say anything else. If you know, you know. Next slide, please, Leah. I'm relatively new in the patient partner role. It's just been over 3 years since I began this journey. I joined the SPORE Evidence Alliance in 2021. The Strategy for Patient-Oriented Research, or SPORE Evidence Alliance, is a pan-Canadian research initiative designed to promote evidence-informed health policy and practice changes. I've had the pleasure of completing their online course entitled A Patient and Public Engagement in Knowledge Synthesis. It was an excellent introduction to knowledge synthesis methods, including rapid reviews, scoping reviews, and systematic reviews. The SPORE Evidence Alliance is a sponsor of our project, and we'll talk about them a little bit further in our presentation. Digital Health Canada is a not-for-profit professional association of digital healthcare professionals. I joined as an individual member, but a majority of members are working professionals in the healthcare system. It was an excellent forum for networking, particularly at their national and regional conferences. I've learned a great deal about digital transformation in Canadian healthcare, particularly through their excellent Wednesday webinar series. And I also attended the eHealth conference in Vancouver in May 2024 as a patient partner. I'm a member of the Patient and Public Advisory Council for NL Support. NL Support is the SPORE unit for Newfoundland and Labrador. The PAC provides advice for NL Support's activities, and like many of the SPORE units in Canada, it's very active in brokering opportunities for patients to become involved in the research through periodic email and their monthly newsletter. I recently joined the Patient Advisors Network, or PAN. PAN is a community of people who have received health services or cared for those who have and are committed to improving healthcare as patient partners and advisors. Improving healthcare as patient partners and advisors for the good of all across Canada. It's comprised of many like-minded individuals, and I would encourage patient partners to consider joining the network. I'm also a member of the AI for PH Community Advisory Board. The Community Advisory Board provides community perspective to the AI for PH, whose mandate is building capacity in AI and big data skills for transformative change in addressing population and public health challenges and understanding how these tools impact health equity. In terms of knowledge synthesis projects, I've personally been involved in 2 scoping reviews. One review with Leah and the team, sought to respond to the research question, what are the impacts of e-prescribing on medication safety in community settings? Participated as a member of the expert advisory panel and assisted with the formulation of the research question and completion of the final report. I also completed some, I emphasize some, abstract and full text screening. The second scoping review is ongoing and is more personal for me. It's attempting to enumerate the various interventions used to support cardiac patients in their recovery from cardiovascular procedures. It was a research question that I wanted to explore. I was fortunate enough to identify a medical student from Memorial University who was prepared to take on the work as part of his research requirement. It's been 2 years. We're in the final stages of the project, just he and I. We worked closely together to screen over 4,000 abstracts, 300 full-text articles, and extracted information from approximately 140 articles. We're about to begin the final report, and I was very pleased that my medical student and partner won an award from Memorial University for that work. Lastly, the EdPatch project is in its first year of operation. As co-lead knowledge user, I hope to contribute feedback and provide oversight during this 5-year project. So why did I get involved with this work? My experiences with the healthcare system were very positive, but there were gaps, particularly in the transition from hospital to home. I felt there was an opportunity for educational technology to assist patients, particularly those with chronic illnesses, to adapt to their new normal. There's been much focus on digital transformation and learning health systems. I felt that my background would enable me to positively contribute in both those areas. So, in summary, I felt that it was my turn to contribute to healthcare improvement in Canada. Over to you, Leah.
Thanks, Rob. So I'm a health librarian and I focus on evidence synthesis in my work. I've been doing that for over 8 years now. And I've been here at the STIC Lab for just about a year full time. For my work, I spend about half my time as the project manager for that EdPatch study that Rob was just mentioning at the last point on his last slide. And then I spend about the other half of my time supporting several evidence syntheses that we have going on at the lab. Personally, my sort of interests lie in developing and improving systematic and scoping review workflows, both here at the STIC Lab and beyond. And I am now privileged to be able to be involved in reviews from the beginning all the way to the end, which is a little bit beyond the scope of what a typical librarian might be involved. On a personal note, I am a mom of 2, and I was just mentioning to some people early on in the call that it's my son's 6th birthday today. So that's a special day, November 14th for me. And I'm also a choral singer in my free time. I love singing. I have a background in music. And right now I am part of the Aeolian Singers. If you're in the Halifax area, our concerts are in a month, actually. So, follow up with me after if you would like to attend some choir concerts this holiday season. A little bit about the STIC Lab where I work. The Strengthening Transitions in Care Lab. We're located at IWK in the Children's Building, and it's co-led by Drs. Janet Curran and Christine Cassidy. We're a health system practice and policy research lab. So not bench science. I think a lot of the time when you say you work at a research lab, people think you're working with test tubes. Not so much. We were actually focused on researching things like emergency care transitions, children with complex care needs, and learning health systems, which Rachel gave a great intro to at the beginning of this presentation. And then also we're sometimes commissioned to do evidence synthesis work in other research areas that we take an interest in, and this project is one of them. As I mentioned in the beginning, this is not going to be a methods presentation, but I did just want to quickly familiarize you with the systematic review process if maybe it's something new to you. The Cochrane Handbook is sort of one of the main text sources that you can use to learn about how to do a systematic review. And their definition of a systematic review is that it seeks to collate evidence that fits pre-specified eligibility criteria to answer a specific research question. And they aim to minimize bias by using explicit systematic methods documented in advance with the protocol. And there are any number of steps that are often depicted in the process. Here I have it divided into 6 sort of steps, starting with defining the research question, then of course searching to find all of the articles you need and screening those articles to narrow it down to a list of included studies, extracting data from those studies, critically appraising them, and then analyzing what you find. Over to you, Rob, to talk about the Spore Evidence Alliance.
Yes, our project was sponsored by the Spore Evidence Alliance patient-led research initiative. The initiative was funded by CIHR, and it was a very competitive process that comprised of an application and an interview. The steering committee reviewed the submissions and employed a James Lind Alliance priority setting partnership approach in identifying the 20 highest priority topics to be funded by the Spore Evidence Alliance. Each topic was prioritized based on the following key factors: impact, unmet need and evidence gap, uniqueness, timeliness, and importance. Topics were prioritized that addressed urgent or emerging healthcare challenges, and 20 projects from 87 submissions were chosen. I was very pleased to have my topic selected for funding. Upon approval, we were paired with researchers and research labs across Canada. I was lucky enough to be paired with the STIC lab in Nova Scotia. It's been a great journey. Since project inception, support from the Spore Evidence Alliance has been great. Funding has been allocated, learning resources have been made available, and a community of practice has been established so that individuals can discuss issues and learn from each other. I would encourage you to review the project topics funded under this initiative. There's a wide and rich range of topics that will add to the evidence available for healthcare improvement in Canada. Next slide, please, Leah. So just a little bit more information about our project. I'll note that the project team and expert advisory committee assisted in transforming my initial question into the project objectives that you see here. These objectives include to identify the effect of digital patient education interventions for patients preparing for and recovering from cardiac surgery, and to identify the media used to deliver digital patient education and how digitally delivered education programs are implemented. We're conducting a mixed method systematic review, and I hope that the results will inform cardiac care centers across Canada with regard to digital education initiatives. Naturally, we wish to publish the results of this study, and thanks to the Spore Evidence Alliance, we're planning a dissemination event in March 2025 that will be held in Halifax and online. Over to you.
Thanks, Rob. All right, so I'm going to kind of go step by step through those steps that I showed earlier, just to talk a little bit about some ways we've approached it and some practical tips if you're embarking on a review. So we always start with a protocol. High quality reviews really require a protocol. It doesn't need to be published in a journal, but it does hold your team accountable to the plan and reduces bias when you develop a protocol in advance. We always use a template for our protocols, and luckily Spore Evidence Alliance prepares one for use for these projects. So we did use the Spore Evidence Alliance template for this, and it contains all the elements of a standard systematic review protocol. And then in addition, it also has prompts to identify all of your team members that you're going to be working with, including knowledge users and patient partners. So this is built in right from the beginning of the planning process to have knowledge users and patient partners on your team. And it also prompts you to plan knowledge translation in advance and to plan how you're going to engage knowledge users who perhaps aren't part of the team, but who will eventually be the recipient of whatever outputs you have at the end of your systematic review. So my tips for this, if you're embarking on a review, is to use a template. And there are lots of protocol templates available online. JBI and Cochrane are good sources if you'd like to use those templates. You can also build your own template from scratch. I always recommend reading examples of good review protocols, and then kind of building based on that. So we actually have one that we've built here at the lab that we tend to use, some of the standard language we tend to use, and we always use a template when we're developing our protocol. And I always also recommend including a timeline in this protocol. This typically wouldn't be published alongside your protocol, but it is really good for goal setting at each stage of the review. And bear in mind that things like full text screening, data extraction, and critical appraisal, they tend to take the longest in that process. Here's an example of our timeline for this project. It doesn't have to be fancy. This is just a table I put together using standard word processing software, just kind of with our targets. You can see our 10-month timeline here. So this is a more rapid kind of review. Our timeline's within a year. And I just planned out how many months we could expect each stage to take, and we've stuck to this pretty well. And you can see here that starting with data extraction, things are taking 3 months, and including critical appraisal and analysis and writing at the end. And so this can extend or condense depending on whatever timeline you have for your project. So if this is a really rapid review, say 3 months, this could be in weeks instead of months. Sometimes we've even done ones that have days instead of weeks if they're really, really rapid. But I do highly recommend sort of mapping out this timeline. Even if it's flexible, it's a really good document to go back and refer to, okay, are we on track with each stage? And I want to just spend some time focusing on the team that we assembled for this and that we tend to work with on all reviews like this. So we have several team roles that we like to fulfill with each review that we work on, starting with the project lead or co-leads. Typically in our lab, we tend to always have co-leads, 2, if not 3. For this case, we have 3 co-leads on this one. And these co-leads, they lead research question refinement. So they're really there at the beginning, identifying the review question, and then kind of going on to lead the decision making for the review. So we go back to them as a sounding board when we need to make big decisions, and they're the ones who are calling the shots for the review. We always have a project manager. That tends to be me. I spend a lot of time scheduling meetings, supporting the workflow, keeping things running on time. So I am a librarian and also a project manager. I don't know how well those 2 things go together, but they seem to work well for me. And then I'm the point person for anyone on the review team to ask questions. I really recommend that this person be a methods pro. And maybe you don't have a big team. Maybe you don't have a lot of people. Maybe the project lead and the project manager are the same person. That's totally cool. But it's just kind of keeping in mind that these are things that need to be done in order to keep a review running on time. As a librarian, I always have to give a shout out to the librarian on the team. You should always have a librarian on your review team to design the search, get it peer reviewed, translate it, executing it, and deduplicating it. High quality reviews should always use a librarian or information specialist to design the search. And then we have an awesome team of screeners. These are usually a group of trainees we have working in the lab, other research assistants or research coordinators or associates working at other labs that tend to be connected with us. I see Tatiana is on here. She's one of our awesome screeners. So they handle screening. We do it in duplicate. So that means that 2 people independently screen, and then any conflicts are resolved. So we do that at the title, abstract, and full text level. So this, again, is a great role for trainees, as well as data extraction. So we have another team of data extractors. Again, we are doing this in duplicate for this review. It's another great role for trainees. And then this group can also, the same group or maybe a modified group can assist with critical appraisal if you're doing that. Critical appraisal is not always a feature of scoping reviews, but it is always a feature of systematic reviews. Then comes analysis and writing, and this can be a mix. Usually by the time you get through data extraction and critical appraisal, there's kind of a smaller group of people. Maybe they did a bit more of the screening or extraction, and then they tend to know the studies the best of everyone who's been working on the review. So they will be able to lend their expertise to the analysis part and making sense of everything that you've pulled out of all these studies. And finally, what I really want to highlight, what I think makes our review team particularly successful, is that we always try to engage an expert panel. And that expert panel is not just knowledge users, which can be like people like clinicians or health system partners, depending on what the topic of your review is, but also patient partners. And they advise the research team on the question, does it make sense? Is it appropriate? Is the eligibility criteria, does that make sense? Is that appropriate? The data extraction fields, are those relevant to the question? Are those things that we would like to see? Is that information that we would like to see from the studies that you're including? And then when you have results, how are we interpreting those results? How are we framing it in a way that makes sense to the people who are eventually going to use this knowledge? And then knowledge translation planning. So how are we going to get these results out into the world? They are really helpful with that kind of thing. So these people typically don't do day-to-day activities like screening or anything like that, but we try to have regular meetings with them. Now, as I said, a lot of my life is planning meetings. It's really difficult sometimes to get experts all in one place to meet. So we do try to at least keep people up to date on email, using emails as much as we can. But I would say that this is just, even though it can be a little bit of a pain, it's a really good idea to try and get an expert panel together. Okay. Ooh. Where did sorry, everybody. Is that back up?
Yeah, you're good, Leah.
Okay, sorry, I just lost my screen there for a second. Oh my goodness. I don't know where the meeting went. I can't see the meeting anymore.
We're still here, I promise.
Okay, I'll just keep talking. You have to tell me if there's anything in the chat. Anyway, so my next tips are about screening. So one of the things that we have put together and improve upon every single time we do a review are our cheat sheets. I think they're one of the most useful things we put together for our teams. And they're mostly to help team members with title abstract screening and full text screening and data extraction. So you can see a screenshot of one over there on the right. So this is hierarchical. It's laid out hierarchically to avoid conflict. So when you are screening in covidence, is what we use in covidence, a conflict can arise when people choose two different reasons for exclusion. So at full text, you have to choose a reason for exclusion. Even if you both agree that it should be excluded, if that reason is different, it shows up as a conflict in the system. So we try to lay it out so people work down this list in order and choose the first one that applies. So you can see our first one here is that we were like if we couldn't find an interlibrary loan for something, that is one of the main reasons why we wouldn't include something. So that's the first reason we choose. And then moving down a little bit, there's a conference abstract. And then as we move down, is it a protocol? We're not including those. Is it a literature review? We're not including those. And then we get into our eligibility criteria about population and things like that. I often get requests for a template for this. It's really straightforward. And I haven't put together a template because it really does change depending on the review. But basically, as long as you kind of have these columns in a table and kind of work through it that way, that's what I'd recommend doing if you want to put one of these together. And as I've said, communication is key. I really recommend scheduling frequent team check-ins. We do weekly ones, or at least to start, we do weekly ones, and it kind of, as we get into the review, they kind of go down to less frequent. But right at the beginning, it's really, really important as people are starting screening to have regular meetings to make sure everybody's on the right track. We use email also a lot and Teams chats. We also use notes in covidence. So like we'll put notes on studies as we're screening if we're unsure of them, just to bring up later as a reminder, or we tag them with different things depending on what we need. And an update on our review progress. So at this point, we have our list of included studies. It's at 39 studies, and our data extraction consensus is ongoing right now. So our next steps is to do critical appraisal. And we are also doing a gray lit search as part of this review. And I'll just say that this Prisma diagram makes this process look really neat and tidy. And I assure you that it is not neat and tidy. So it is often the case that you get into full text screening and then you kind of like, oh, let's clarify some of that eligibility criteria. I'm not quite sure if we were 100% clear, or, we start data extraction. It's like, wait, this one was included, but actually I don't think it hits all of those eligibility criteria. So it may look very straightforward, but it is not always straightforward. And I also just wanted to highlight this the box that's at the top on the right, the references from other sources. You'll see that we have 136 from citation searching. So as I said on the cheat sheet page, we were excluding systematic reviews from this review. But if we found relevant systematic reviews, we wanted to screen their list of included studies to see if any of them would be relevant to this review. And this proved to be a really, really important process for this review because 5 of our included studies came from this. That means that those are 5 included studies that would not otherwise have been found if we had not done that step. So I really, really recommend doing that step. Back over to you, Rob.
Yeah, I was asked to just to reflect on a couple of points of the process to date. And from my point of view, first and foremost, the team is a critical component for success. I'm fortunate to be part of a group with great expertise, and it includes a host of trainees or PhD, postdoc, master's students that have made the work to date much more manageable and enjoyable. I was very grateful for the knowledge synthesis training opportunities that I took before the project started. It helped tremendously in terms of understanding the process and being able to confidently contribute to the discussions. The development of the protocol, I think, as Leah suggested, was a critical stage in the process. It forced me to think about the research question and refine it accordingly. While it's common for patient partners to contribute at the beginning and to develop the question, and at the end to ensure the results are disseminated appropriately and in a format understandable for the target audience, in this project, I chose to participate throughout the process, including the abstract and full text screening with expert guidance from Leah and others, of course. It was a great way to understand the process more completely and to get a feel for the subject matter. As Leah has suggested, our expert advisory committee has been critical to the project. At certain milestones along the way, we've been able to discuss issues with these experts and establish a clear way forward. I note that Donna is with us today. Donna is a member of our expert advisory committee, and I want to thank her for her input. Finally, this has been a tremendous growth opportunity for me personally. I'm learning in many different ways and meeting a great group of people along the way. It's quite satisfying to think that the project will result in evidence that may improve supports for cardiac patients in Canada. I started with a photo from Newfoundland, so I'll end with 2 photos from Ottawa. I took these in June of this year in a park just 10 minutes from my home. So I'm very lucky and very pleased to live in Ottawa. So that's it for me. Thank you.
Yeah, thank you, everyone. We look forward to answering your questions.
Thanks, Rob and Leah, for sharing your work. Lots of food for thought about how to gather and interpret and make sense of the mountain of evidence that's out there on any particular topic, and also lots of great practical strategies for doing this type of evidence synthesis. So just remind everyone, if you have questions, feel free to drop them in the chat, and if you want to ask them yourselves, or you can raise your hand. We're a small group, so I'll keep my eye out for hands. And Leah and Rob would be happy to answer. While I give people a couple of minutes to get their questions in or pull them together, I guess, Rob, you had ended there. I thought one of the things that I love about this project is the sort of the fact that you had brought forward this idea based on your own experience. And then you both talked a lot about the involvement of the expert panel and bringing in those different perspectives to refine that process, and then how this might be applicable to other patients or other health system workers going forward. So for this particular project, are there particular applications that you have in mind for what you're learning, things that you're starting to see that may be helpful for cardiac patients? And Rob, maybe I will put that to you first, that question.
Yeah, and I think we will see. I have a sort of a vague notion that using the principles around educational technology in terms of resources and facilitation, that there may be either a provider-led or a patient-led curriculum package that could be put in place for patients to supplement it. The brutal reality, I didn't mention it, but when I started to look, cardiac rehab, which is the gold standard for cardiac patients, is very undersubscribed. I think the literature says something like 20 to 25% of people take part in that. What do the other 75% do? I don't know, but I'd like to be able to put low cost sort of interventions in place that may be able to help them. So that may be a pipe dream. I'm looking forward to seeing how the evidence points us forward on that.
Thanks, Rob. Absolutely. I see you're nodding. If there's
Yeah, no, I
nothing,
don't have anything else to add. So we are methodologists. This is why I love doing these kinds of reviews. It's like people who want to use the information come to us. We find the evidence, then we kind of kick it back over to them. So yeah, I'm excited to work with our experts and Rob to figure out where it needs to go.
it does seem like that expert panel is a bit of the secret sauce, kind of getting those perspectives, because you do have clinicians as well as part of that group.
Yeah. We are very lucky to have Dr. Greg Hirsch, who's a cardiovascular surgeon here in Halifax. We have a nurse as well, Madison Hickey. She's on our team. We also have some nurses on our research team as well. And we have some researchers from the area of cardiology as well. So those are the types of people in our group.
And
definitely
patient advisors who keep us
Yes.
honest with regard to the patient perspective as well.
Yeah. I think we do often hear when we're talking about learning health systems, not just the kind of the expertise, but that those relationships that are being built up as well with people and individuals in the health system in terms of translating. Now, I see in the chat we have a question from Rosman. She was asking if you have used any AI tools for the title and abstract screening.
Yeah, so not for this one. So right now in the AI space for screening, they typically have been geared towards identifying things like randomized control trials, which we are not limiting to in this review. So we didn't use any of like Covidence's built-in AI tools for this right now. However, Rob has been awesome to have on the team because he loves a tool called Perplexity. Is that right, Rob? You've been putting it to task to do some things like put in questions, like, getting it to define. We were kind of on the fence about, for example, what types of surgery we were including in this review. And so Rob put a prompt in just to be like, hey, what do you define as cardiac surgery? And it kind of spit out an answer for that. It's just been kind of useful to use that. And then we're also using another AI supported application. It's the name for translation. The name is escaping me right now. What is it? Rob, do you remember what the name of our translation?
I can't remember.
It just escaped my brain. It's just like a level higher than Google Translate. So we decided sometimes our team decides not to include non-English studies. We wanted to try and get some of those non-English studies. We're finding a lot of studies from out of China in this space. So we didn't want to exclude the ones from China. So we've been using an AI supported translation tool that works okay, works enough to at least get at like the meat of what a study is about. So that's been kind of cool too.
Megan Churchill says it's DeepL.
DeepL. Thank you, Megan. I didn't see you there. Megan's also a part of our awesome screening and data extraction team. Thanks, Megan.
Yeah, and Leah, since I know you can't see the chat right now, just to let you know, Rosman responded and said she just heard about Perplexity. And it's great for gray literature searching, and thanks for the excellent presentation.
Oh, good for gray lit searching. That's interesting. I'll have to look into that when we start our gray lit.
Yeah.
Perplexity is a great general tool anyway. Just, I know it's off topic a wee bit, but to ask questions just generally, rather than do the traditional Google search, Perplexity allows, it's searching and summarizing the internet, but it does a good job.
Interesting. I feel like I have to explore this place. The other one I've heard of is it Distiller? Is that the other sort of
Distiller is another
reviews, or is that different?
Yeah,
it's a screening
tool for reviews, but they also have they've developed an AI pre-screening tool for RCTs. So it will weed out everything that's not an RCT for you in advance of screening. So yeah.
Okay. So similar functionality to the
similar,
Covidence.
yeah.
And there was also a comment from Donna saying from a member of the advisory panel, it's been a 5-star experience so far, equally important and excited about the potential application of learning to other areas as well. So Leah, I just thought I'd share that since I know you can't see the chat.
Thanks, Donna.
And Kelly Trask has asked, you mentioned finding articles using citations and that these were articles you would have otherwise missed. When you find a number of new articles this way, do you modify your search strategy to capture them and potentially others?
Yeah, so I don't tend to go back in time to modify a search strategy. I try to do a bit of this in advance of hitting go. So, like, I will always ask a team that I'm working with to identify a sort of gold standard set of articles, depending on how much literature there is on a topic, maybe 5 or 6 articles that you know for sure that you would include. And then I test my search strategy against that to make sure that those articles are coming up. Now, this is a pretty rapid review, a year timeline. So we knew that we didn't want a huge amount of records to screen. So that means, you have to balance that sensitivity and specificity. You're kind of making decisions like that. So for this one, we tended to be a little bit on the more specific side, knowing that we had these kind of backup supplementary search methods. I'm a huge proponent of those supplementary search methods because I think that it really helps. You can never find everything with a single search unless you search something really huge. And we know that we have those supplemental search methods. So that's what I tend to do. I wouldn't go back and change it unless it was something really egregious. And then it'd be kind of like back to the drawing board, which I guess has occasionally happened, but hopefully not too often.
Great, thanks, Leah. And also, Sam has commented that Consensus is a useful plugin for any ChatGPT users as well for AI-enabled tools. Interesting. There's such a proliferation now of different tools out there. I feel like there could be a separate session.
It seems like there's a new one every day.
On how to use AI to make your review easier, particularly for those victims. Okay, so if there's any other last questions, feel free to drop them in the chat. Otherwise, I'll wrap us up with one. And so it's been really interesting to see kind of the tips and the tricks for how you do take this collaborative approach to evidence synthesis. And I was just wondering if you had any last words of advice on how to get started with a project like this. And Leah, maybe I'll hand it to you first.
How to get started? I think it really starts with a good question. So again, I'm going to put a shout out for librarians out there. If you have a research question that you're interested in, whether you are a knowledge user, whether you are a patient partner, I would really recommend just getting in touch with your local health sciences library. I know that the Kellogg Library here in Halifax will serve anyone who comes to them for help. To look and see if your question has been answered. So that was one of the first steps in the process that Rob was describing when they looked at those 87 applications. They were looking to see, okay, has this question been answered? Has it been answered well? Has it been answered recently? And in addition to like if it's actually been answered or not, is this feasible to answer with a review? So a librarian can really, really help you decide like, okay, whoa, this question's way too big. It has like 5 questions in there. Or, oh, this question's like so focused. I'm not sure if you're going to be able to find enough to answer this question. So I would totally recommend getting in touch with your local librarian who love to help people. And that's my first step for getting started with the review, I would say.
And without putting in too much of a plug, I see Christy Hancock is on here, and she is our evidence synthesis coordinator at the Maritime Spore Support Unit. So if you're looking to do an evidence synthesis to support patient-oriented research, you can actually get in touch with us and she can provide some advice too. She's very good at figuring out that Goldilocks problem. She says, hi, yes, indeed, in the chat about the right size research question. Rob, any advice from the sort of patient partner perspective coming into this, things that you find helpful for getting started?
Getting started is interesting. I wonder sometimes whether it was planned or I was just lucky. But again, I'll echo exactly what Leah said. It was a librarian that started me down the right road in terms of focusing the question and really trying to, again, plan and get the question in place, find out exactly what what information is out there and start to learn. And from my point of view, I started just with a question. I said, God, I wonder, literally before I left hospital, I said, literally, God, there's got to be a better way. That's how all this started. And 3 years later, here I am. Well, no, it was 5 years ago. It's my surgery. But again, just, there's got to be another way. How do I find out? Again, I was fortunate enough to stumble on the patient-oriented research initiatives through CIHR. That were there, the SPORE unit, particularly in Newfoundland, the NL4 unit. So just keep, like any things that you want to learn, just keep digging, and little by little, the pieces fall in place. That's a pretty generic answer, but that's all I got.
No, I love it. And I think it's interesting how you say you start with the idea, and then through these collaborations and programs you become involved in, you work together to refine it and kind of pull out that evidence and then think about how to use it. And I think that is at the heart of what we were talking about today.
Mm-hmm.
So unless there's any other last questions, and I don't see any in the chat, I think we could wrap up a little bit early, give you some time back in your day. So I just want to thank our speakers for their presentation, and to everyone who's joined us today for listening and contributing to the discussion. I will send around a short evaluation link this afternoon. Please do share your thoughts on the webinar, any ideas for future presentations. And eventually, as I mentioned, the recording will be up online on the MSSU website. So thanks again for joining us, and I hope everyone has a good afternoon.
Thanks, everyone.
Thanks, everyone.
Thanks, Rob. Thanks, Leah. Bye now.